My name is Jan and I'm one of the rheumatology specialist nurses. You've been asked to watch this as we are starting you on a biologic medication or have decided to switch to one that you're on. You can watch this 10-minute video as many times as you need to. You'll also have an appointment with one of our specialist nurses to make sure that you've understood the information and to answer any questions that you might have. I'm going to tell you about biologic drugs, which are also called advanced therapies. I'm covering a lot of information, but after your nurse appointment, you'll get a letter that includes all of the things that I'm going to tell you about. Your body makes proteins that are messengers within your immune system. One of their jobs is to help fight infection. In conditions such as rheumatoid or psoriatic arthritis, ankylosing or axial spondylitis, lupus or vasculitis, these messengers can cause inflammation when there is no infection to fight. This inflammation results in pain, swelling, and sometimes damage to bones, joints, blood vessels, or other body tissues. Biologics damp down this response, reducing the unwanted inflammation. Biologic drugs may increase the risk of some illnesses being reactivated if you've come into contact with them. So before starting treatment, you'll have a chest x-ray and blood tests to check if you've ever been exposed to tuberculosis, HIV or hepatitis. There may also be some extra tests for specific biologics. You may not be able to take some of the biologic drugs if you've ever had repeated or severe infections, multiple sclerosis, or if you have a close family member that suffers from it, cancer or an illness that would make you more likely to develop cancer, a serious heart condition, inflammatory bowel disease, or lung fibrosis, which is scarring of the lung tissue. We will check your X-ray and blood test results before you start treatment and ask you about the conditions that I've just mentioned. Biologic drugs can be administered in a number of different ways: tablets, injections, or as an infusion on our day unit. The RUH uses different brands of biologic depending on availability and cost, so you may switch to a different brand once you're on your medication, but this shouldn't make any difference as it is still the same medication, just made by a different company. We prescribe your medication, but injections and tablets are delivered to you at home by a home care company. You will also be offered training to show you how to do your first injection. This can be by watching a video call with a nurse, or by having a nurse come to your home. Infusions will be administered in our day unit, and they will contact you with an appointment to come in for your infusion. Biologic drugs are prescribed alongside your other rheumatology medications, and when you start your biologic, you should carry on taking these. You should also continue any anti-inflammatories and painkillers if you need them. Common side effects of biologics are headaches, an upset stomach, or feeling sick or unwell or tired when you first start the medication. This will be a new drug for you, so there's also a risk of an allergic reaction. This can be at the injection site, where you may experience redness, pain or swelling, or a more generalised allergic reaction with an itchy skin, a rash, a cough or shortness of breath. Most reactions or side effects are mild and will pass without any intervention. There are other, much rarer but potentially more serious things to look out for. Some biologic therapies have been associated with certain types of skin cancer. These can be readily treated when diagnosed early. If you develop any lumps or bumps or any changes to your skin, it's important to go to your GP to get them looked at straight away. You also need to let us know about any new diagnosis or investigations so that we can still make sure that your biologic is the safest one for you to continue. Some of the biologic drugs can cause a lupus-like reaction. Look out for a rash, particularly across your face, any fever or joint pain. PML, progressive multifocal leukoencephalopathy, is very rare and it affects your brain and nervous system. Look out for any problems with movement, vision or speech, or any numbness on pins and needles. If you get any of these symptoms, then please seek medical attention without delay. Tocilizumab injections and JAK inhibitors such as upadacitinib can cause an increase in cholesterol levels or blood pressure. JAK inhibitors also increase the risk of blood clots. Some biologics can cause a flare of inflammatory bowel disease. We should have checked this with you when we decided which medication to start, but please report any changes to your bowel habit that happen after you've started your biologic. I know that these risks and side effects can sound daunting, but most people tolerate their biologic therapy without any problems. And before we reach the decision to start a biologic, we think very carefully about you as an individual and consider all of the risks that might apply to you, and we choose the biologic that we think will suit you best. If you have any problems or side effects, you can speak to one of our nurses by calling our advice line. There's also an app or an interactive form on our website that you can use if you prefer. I'm now going to tell you about things that you should remember while you're on your new medication. If you have any symptoms of infection, such as diarrhea, a cold, a sore throat, a fever, or a run at antibiotics, you should stop your injection or tablets until you're feeling better and the infection has resolved. If you're on infusions, you should contact our day unit to delay your infusion until you're better. If you come into contact with someone who has chickenpox or shingles, you'll need to get a blood test to check your immunity. You should contact us and we will arrange this at your GP surgery. If you develop any symptoms of chickenpox or shingles, you must stop your biologic and seek medical attention for antiviral treatment without delay. Listeria and salmonella can be dangerous in people on biologic therapy, and so you should try and reduce your risks of food poisoning. You should avoid raw cheese and raw milk, and also be cautious with raw or undercooked fish or shellfish, undercooked meat pate, and refrigerated pre-packed foods once they are opened. We recommend that you have the one-off pneumococcal vaccine, the flu vaccine, and the COVID vaccine. If you're over 50 years old, then you'll also qualify for the shingles vaccine. While you're on biologic therapy, you should avoid live vaccines, as there's a very small risk that you can become unwell from the vaccination. Live vaccines are usually ones that you need for travel, and so if you do need any travel vaccines, then check with the nurse who's giving them to you that you're not having the live version. If you need an operation, your biologic should be stopped prior to surgery and shouldn't be restarted for at least 2 weeks after, once any wound is healed and the stitches are out. The letter that you receive about your biologic will let you know exact timings for the medication that you're on, and infusions will also need to be scheduled around the dates of any surgery, so let the day unit know as soon as possible about any procedures. Normal dental work is fine, but if you need anything that goes below the gum line, such as an extraction or root canal, then treat it like minor surgery and hold your medication for the recommended time. If you were in an accident or it was an emergency, you can still have a procedure without holding your biologic, but it just means you have a small increased risk around infections. Some biologics are safe for pregnancy and breastfeeding, and others are not. Again, your letter will give you more information, but if you are of childbearing age, this is one of the things that we would have considered when choosing your medication. You should have a regular blood test while you're on biologic therapy. For most drugs, the blood tests are 3 monthly, but your clinic letter will tell you what you need to have and how often you need to have them done. It's your responsibility to arrange to have these with your GP when they are due. Your biologic prescription is renewed every 3 months, and if you haven't had a blood test, then we can't sign your prescription and your treatment will stop. Some people notice an improvement in their condition very quickly, but it can take 3 or 4 months before we see the full effect. Please call the advice line and let us know when you start treatment, and we will arrange your follow-up appointment. Thank you for watching this. Please make a note of any questions or things that you would like any more information on, and we can discuss these during your appointment.